Hello, my name is Sunalini Matthew and I am in conversation with Dr. E.S. Krishnamoorthy.
Hi, Sunalini.
Dr. Krishnamoorthy is a neuropsychiatrist and he runs what is called the Buddhi Clinic in Chennai, India. So we are in a setting that's not quite psychiatrist clinic, right? We have an Ayurvedic tool here. We have something that looks complicated, but it looks like it's from an allopathic practice. And then there are kids' toys. So what's going on here, Doc?
Thank you, Sunalini. And you're absolutely right that what you see here is kind of in part encapsulates how we work with children in Buddhi Clinic. The logic and rationale is that it's not just about one type of symptom. For children, symptoms can be physical, symptoms can be psychological, symptoms can be cognitive, symptoms can be emotional, behavioral, symptoms can be social, symptoms can be sensory. So there are a number of ways in which children with developmental disabilities present. And what we do at Buddhi Clinic is blend conventional therapy, so occupational, neurodevelopmental therapy, speech therapy, psychological therapy. We blend with that a whole house of Ayurveda, naturopathy, and yoga. In fact, we have a protocol for children with developmental disabilities that we have now tested on a fairly large number of children with a lot of success. Where we simply use 3 treatments repeatedly over a period of time to improve attention, improve mental clarity, improve sleep, improve digestion, improve behavior. We also have various brain stimulation procedures that we can use on children. Transcranial direct current stimulation is one that we use quite a bit to help children. It can reduce anger outbursts, it can reduce anxiety. We have a protocol that improves speech, especially when we combine it with speech therapy. So, in a sense, there's a lot we can do for the child when we have this integrative approach. And in this clinic, across 4 floors, we have 15 treatments, which not just children, but people across the lifespan can use. And we have spaces and professionals who are completely oriented to the care of the child as well.
You talked about 3 therapies that you use in your protocol. What are these 3 therapies?
So there is an Ayurvedic head and neck massage with medicated oil. It's called Shiro Abhyangam. There is mud packs that we use, where we use river mud as a pack on top of the abdomen. It helps settle the abdomen, relieves constipation, relieves irritable bowels, relieves frequent urination. And then, of course, we do something called reflexology, which is thought to relax the mind but also improve the circulation. And this is the holistic pack that we do for kids with developmental disabilities. Many of them respond extremely well. Of course, we tailor that. For example, a child with physical disabilities will have a lot of neurodevelopmental therapy. A child with speech difficulties will have speech therapy. A child with behavioral problems may get brain stimulation as well and work with the behavior therapist. All that, but there is this particular holistic combo. We've actually published action research, including a book on autism, on how we use this combination to treat children. We've used this in a special school inside the school itself, where we had a therapy ambulance parked and we delivered these treatments to children as they attended the school. And we've learned a lot from all those experiences.
Which leads us to today's discussion. So today we're going to be talking about integrative health for the developmental brain. I'm going to redo that. Which leads us to today's discussion. So today we're talking about integrative health for the developing brain. So from what we know, the brain starts developing right from the fetal stage. Can you take us through this a little bit? What is happening in the fetus? And all these therapies that you talk about, can they be administered to the mother and help the child in some way at the fetal stage?
Both very interesting questions. As far as the fetus is concerned, the earliest neurological development is the neural tube. And in fact, when we try to do early scans as preventive health measures, ultrasounds, women are mandated to have their first one before the age of before 3 months of pregnancy. What we do look for is whether, one of the things we look for is whether the neural tube is intact and the neuraxis is developing as normally as it should. Because defects in that are an indicator of future disability. Sometimes one fails to pick up the defects and one picks up the defects in the 5th month scan, and that could be a little late to do anything. So tracking the development of what starts as the neural tube, the neuraxis, which results in the brain and the spinal cord developing in the fetus, is extremely important part of antenatal health. And it is something that, as much as looking at the fetal heartbeat, looking at the fetal position, looking at the general health and development of the fetus and so on, this is an extremely important part. And of course, today there are other genetic and other biological parameters we can check as well in children. Now, for the mother, one thing which is very, very important, which brings us to what is the basic framework of why people have developmental disabilities, is an optimal environment. So the mother provides that optimal environment for the fetus. And anything that disturbs the mother's optimal environment is going to, by default, have an impact on the developing fetus's optimal environment. And the Swedish studies of developmental disability, that's what they've shown, that invariably children who go on to develop a developmental disability, the optimal environment has been disturbed either during pregnancy or around the time of birth, or indeed soon after birth. So optimality is a very, very important concept. And when it comes to integrative health, it has a lot that it can offer a pregnant mother who is preparing to deliver her baby. Now a lot of people do, for example, yoga pre-pregnancy. A lot of people do antenatal exercises. But being calm, being free of anxiety, being in a good mental space, being able to enjoy things like music, all these are obviously extremely important for the mother and will have very positive influences, we believe, on the growing fetus. And therefore, apart from these things as experiences or as part of programmed classes and so on, which a lot of people do today, integrative health can be helpful. There's another thing. As you know, when a woman is going through her pregnancy, one of the things that spoils the optimality for the fetus is any medication the woman is forced to take, because many of these medicines will cross over and might have an impact on the fetus. And therefore, a reduction of medication and the use of non-pharmacological techniques as an integrative health can be very, very useful to women when they are going through their pregnancy, because inevitably you will get symptoms of one kind or the other, and to be able to solve those symptoms or get relief without medication is probably extremely important, more important at that time than any other time in a woman's life. So,
right. As babies grow, how does their brain develop? And how can parents support this brain development? I'm thinking optimality may be key here too, but I'm sure you'll take me through the details.
Oh yes. One of the interesting experiences talking to parents from abroad who are now visiting post-pandemic is that for a couple of years or more, the small children have been quite isolated, even more isolated than usual. And if you contrast an Indian setting with, say, somewhere in the US, you could live for months in a house and not really know your neighbors, which is something that never happens in India. And what happened during the pandemic there to many of the children I'm seeing now is that their interaction was only with their parents, and their interaction was otherwise restricted to the television. So other humans were strangers, and meeting other humans was something they never did. Um, Now, why am I saying this? I'm saying this to say that there is something to be said for diversity of experience for a child. And for a child to have a great diversity of experience and soak it all in is extremely important, because brains are very plastic and adaptable. And children, in particular, because they are so curious and they pick up everything from their environment, learn so much from their environment. So, if you ask me what is right for a child, I would say a whole diversity of experiences, a smorgasbord, obviously, but without overloading a child, is probably going to be very, very good for a child to interact with different people, different places, different environments, experiences, animals. All this is very good, as is, say, music, as is movement through dance or sport. So I think exposure is good, graded exposure, purposeful exposure is very good. And we talked about multiple intelligences earlier. If a child shows a yen for a particular type of activity, then obviously, even more so, giving that child very sustained and very meaningful exposure is probably very important too as they grow up.
So, what you're essentially saying is diversity of experience is important, but also depth
Yes.
of experience in whatever the child shows an inclination for.
Yes, an automatic inclination for.
Right. So, young parents are often in the pediatrician's office with fevers and coughs and colds, but they're also in the office to measure development of the baby and then the child. When some of these are not met, is there a structured way that the pediatrician in India redirects them to a specialist?
I don't believe that there is a uniform structured way anywhere in the world. And pediatricians and doctors, like doctors of any discipline, can be very varied in their ability, obviously, to assess these things on their own as well. Quite naturally, it's a function of experience, training, inclination, and so on. And of course, time. If you're in a really busy OP with 100 crying children, you may not really do justice to the developmental evaluation that you have to do. But when I think all of them are trained and equipped to sense that something is not right with a child, because they're trained and they watch children grow, so they're very good at that. Those who work in environments where there is the ability to refer to a team that will be able to follow this up with the doctor's suspicion up with an assessment are the fortunate ones. Others are probably in a situation where they could point the child out or the parent out to one particular specialist who may be helpful. I know pediatricians who refer to their colleagues who are developmental pediatricians, or choose to send the child to just the psychologist to begin with. But making a start somewhere makes a lot of sense. So I think going from the pediatrician's office to someone who can do an assessment or a component of an assessment is a very good start if you can get there. And usually then what happens is you are led on to see other people who are relevant in that ecosystem.
Right. And how early can interventions help?
So our youngest children who come in for interventions are barely 6 weeks old. And this is when there has been a story of things not being right, and clearly the child is not thriving very well. That's not extraordinarily common for us, of course. That happens once in a while. More commonly between 3 and 6 months, uh, sometimes between 6 months and a year. But sadly, even today, I get children who have not sat up until the age of 3 or 4 or 5, and that's when they are coming. So, to answer your question, ideally, as soon as you recognize that there may be a problem, is the right answer, because we have ways of measuring whether it's intellect, whether it is neurological, physical milestones, whether it's language or interaction. We have ways of measuring these things quite early, so we don't have to wait necessarily. We may have to wait to validate, but we can have a high index of suspicion through our assessments.
But what do you do with this suspicion? I mean, we're talking about an infant here. Then what?
So there is a whole process. So I'll give you an example. When it comes to a child turning around and crawling, for example, and we are now talking early milestones, right? One thing that has to happen is neck control, right? And if a child comes to us with difficulties in moving around and a few months old, very often that's what we find. The neck control is not developed. And one of the things that leads us to do is to work on the neck control as a first milestone. Because when you achieve neck control, then you are able to work on other things. So work with a child who has a developmental disability usually proceeds in stages. And I always try and explain this to the parents, that there is a child who's growing like this, and there is your child who's somewhere here, and there is a gap between the two children. If you did nothing, what will happen is the gap will widen as time goes by. And all therapy is to try and keep this gap non-expandable to the extent possible. And sometimes you're so fortunate that you actually start catching up also. So in a sense, therefore, early intervention, sustained intervention is extremely important in order to help children. And of course, like any other condition, there are children who the help we give only has limited impact. There are children in whom the help completely transforms the outcome. Both can happen. But I think we all have it in us a duty to try. So.
Absolutely, yes. So you've been practicing for several years now, Doc. Over the years, have you seen a change in the kind of neurological disorders that come to you? And how is it different with the treatment as well?
So one of the things that definitely has improved is, I think, the number of children with serious developmental disability due to poor antenatal or perinatal care has fallen, at least in our observation. And I think it's true that antenatal and perinatal care has greatly improved. And Tamil Nadu especially, it's improved in the primary healthcare system itself considerably. What we do see emphasis on learning disabilities. So more parents reach out to us for concerns about learning disability early rather than late now. And I think that's an emphasis. Smaller families, parents are more focused on these things. There's greater awareness. Autism is the other. I think there's been a lot of public awareness about autism more recently. And again, therefore, that leads in the last few years, that has led to more people seeking clarification or being concerned, or even just saying, I think there's something wrong, can we look into it? ADHD, as we were talking earlier in one of the conversations, is very hot topic in that sense. And I think hyperactivity in children especially is also amplified by smaller homes, smaller families, dump the kid in front of the TV with few distractions and so on. And that is really shows up when people then come to see, because schools today, and that's the huge big change. Many schools have counselors, certainly in Chennai, and very often the school is asking for clarification about the child's health. So in that way, I think early recognition of some of these disorders has really become, quite significant, quite common.
How much of these disorders are connected to the intelligences that we spoke about? My question is it possible that a child who's quite kinesthetic and who maybe just wants to run around a classroom, doesn't mean to be disruptive, but maybe just has that kinesthetic energy and maybe does really well on the sports field?
Absolutely, which is why one has to be very cautious in making diagnosis. That's one. So there are two ways. You're absolutely right. There are examples where the child really doesn't have a disorder. He has a certain type of interest and intelligence that he or she is not able to express adequately in the school setting, and that's becoming the problem. That's one. The other, of course, is that recognizing that can often be the balm to help a child, normalize a lot of activity and function better. So there is that as well, that we are able to use that understanding of intelligences to try and help a child improve his or her academic performance or communication or learning ability, for that example. For example, a child who is big into rhythm, converting everything into sing-song helps the child remember a lot of stuff.
Yeah.
So in a way, there are things that you can do when you work with the child to make it easier for the child if you leverage on the child's natural inclinations.
Right. In India, we're so fixated on IQ. All of our toys, everything, our learning system, our education, everything is geared towards IQ. And ultimately, probably, becoming either a doctor or an engineer, unfortunately. How do you explain to parents the importance of EQ and the importance of, we talked in a previous episode about the importance of resilience and adaptability?
Great questions, and often not easy in many circumstances. We are a very aspirational society, and many parents would like to give their children what they feel they lacked or what they did not have. And providing that, they believe, is extremely important and the answer. Sadly, of course, that may not be what suits that child or what the child really wants, and therein there is a gap. There is a real gap. One of the other challenges about very strong academic focus is that it's at the cost very often of other forms of development. So, for example, sport is extremely important in the context of a child's growth. Teaches them team play, teaches them discipline. But if you don't give the child time for sport, then you're losing all that. In the same way, the creative spaces, the creative endeavors have a lot to teach a child in so many different ways, including personal satisfaction, accomplishment, sharing, which again does not happen for lack of time or lack of opportunity or a belief that that is somehow not important. So one would definitely strongly recommend a well-rounded approach to bringing the child up. That yes, conventional education has a role to play, but learning beyond borders is probably very, very important for a child as well. And some of the things that you can do, for example, pick up an atlas and sit with the child, or indeed watch a YouTube video of something from Discovery or National Geographic or the History Channel in order to stimulate your child to learn that. And recognize that children lend themselves automatically sometimes to alternative learning. And this is extremely important. So my younger son had an exam on an English exam coming up the next day, and I knew it was Shakespeare. Here he was sitting and watching the telly. So I was first very surprised that he was watching the telly. He's got an exam the next day. Then when I peeked into the telly, I realized it was Shakespeare. And he said to me, well, this is my portion. So I said, I'll watch the movie, not read the book. Now, your conventional mind tends to rebel against that because you can't possibly learn something from a movie. You have to read it from the book. But, logic tells you that yes, it's as possible to learn from watching a play or a movie as it is to learn from reading a book. And I guess that this is something that we have to adapt ourselves, because I think for the today's generation of parents, learning beyond the book was not an opportunity or an option.
Yes.
Whereas the current generation of children, learning can be accomplished in so many ways. So I guess that, I think that again we go back to diversity of knowledge being made available in so many different ways to a child.
Also the adaptability of the parent. A lot of us as parents have access to knowledge, and we want to use that knowledge to be very purposeful at all times. How much is too much?
I think this is something to be also very mindful of. That in a sense, your 3 decades of experience is probably a bit too much for your 7 or 8-year-old. And I think so one needs to be mindful about how much a child can do and take. People often, for example, in their anxiety or aspiration, pack their child's day with things. Children need downtime. And a lot of processing happens for children too in downtime. And we often tend to forget that. Children need time for play. And a lot of their social lessons, a lot of their emotional development happens through play.
Free play.
Free play. And we don't always understand that. So in a sense, I would say, yes, by all means, be eager to give your child the diversity of experience, but at the same time, don't interrupt what would be a normal, childhood of exploration, of discovery, of interaction, which all children should have.
Along with play, sleep is important too. But we don't really take that into account so much as parents. And a lot of children will resist waking up in the morning. Most children do. How important is sleep?
They also resist going to sleep. And if you think about it, when we were children, there was sort of lights out time. And it was so much easier to implement, I believe, for that generation of parents, because there was less by way of distraction. I mean, Doordarshan's bid you goodbye at 9 o'clock, and there's not much happening anyway after that.
Yeah.
The electronic distractions were simply not there. So in that sense, I think during the working week, for children to have that rhythm of a reasonably early time to bed, and therefore naturally adequate sleep, and therefore a reasonably early time to rise, is extremely important. But very, very difficult to implement in real life, because there are shows we want to watch, the news is on, there may be an elder who's wanting to watch something on TV in the house. So I think it's become that much more challenging.
That's right. But what is happening when a child sleeps at different stages of life?
I think the one thing we do know is that adequate sleep is very protective. Sleep is your brain's time to regroup itself, get its nutrition, and in a way really get its act in order. And the more you cut it, the more likely at any stage in life, this is not just childhood, if you are sleep deprived or you are depriving yourself of sleep, you are definitely not doing your brain any favors. And in adults and elders, for example, we now know that that's the basis of Alzheimer's disease, that's the basis of diabetes, that's the basis of mental health, a lot of things. So, in a sense, therefore, adequate sleep is a bit of a no-brainer, but we are kind of culturally no longer designed for it, in many environments.
You touched upon something that you said was brain nutrition. What is brain nutrition?
So I don't believe it's a particular food or a particular item of consumption that is a nutrient. There are a very large number of nutrients that benefit us, and therefore it is a wholesome and a diverse diet that we are talking about. But for children in particular, there is a danger of, I want to talk about the opposite, when people put them on diets in the belief that those diets are good. And I want to talk about the danger of that, in the sense that you are actually depriving a growing child of certain nutrients when you go down specific dietary routes.
Have you seen that happening?
Oh yes. And
what are the most common ones?
Well, the one diet that a lot of people do try is what's called the gluten-free, casein-free diet, when they are concerned about autism spectrum. Now, one of the challenges is that obviously, while that may be in some children in some way helpful, it also can leave the child nutritionally deprived. So the one thing, of course, is a wholesome diet. That's extremely important. The other thing is, I think that children learn their nutrition lessons and nutrition habits from the family. So learning to eat diverse, learning to eat mindfully, learning to make sure that you get adequate quantities, not too much in any meal, the avoidance of pre-processed foods, especially in the young, the availability of fresh fruit and vegetable in the diet, and healthy meat in the diet if the family is inclined to eat meat. These things are probably very important for the family, very important for the child to learn early. Milk, while you go through phases in society where milk is kind of disparaged, but quite honestly, it's a wonderful source of calcium, and thereby also vitamin D, which is very important for your bone health. So in a sense, I think a wholesome diet, as we were taught to earlier on in our lives.
Right. Children today are growing up with a lot more stimulation, as we talked about, right? You can't say no. It's difficult for a parent today to say no. The child may go and get it somewhere else. How do we as parents protect our children from this overstimulation without seeming like complete ogres?
So one of the things that I often talk to families about is, if you're trying to implement something, it needs to be for the whole family. If you try to implement something selectively for the child, you're going to fail. So, for example, with food, if certain items are considered no-go, then it should be no-go for everyone. Now, at the same time, it's very sensible to allow cheat days, and it's very sensible to do what we call limit setting. So, say for example, ice creams are allowed but only on Sundays, whatever. I think that there is that wisdom in kind of setting boundaries which is for all of us. And I think then it becomes easier to justify setting those boundaries with children as well. Because fairness is something that appeals to a child. Fairness appeals to all of us, but especially for a children, fairness appeals. You see, mommy and daddy are not doing it. So why don't we all wait till Sunday till we do it? It's not a bad thing. Children understand that. Children understand consistency very well. So being on the same page is extremely important, and not letting two parents shouldn't come at it from two different perspectives. That doesn't help the child. It doesn't help your case with the child also. And being very transparent. So for example, we had a toy shopping moment years ago with one of our children, and I had said, you can buy anything but up to so much. We'll come with you. You can buy one thing and you can buy it up to so much. So walking around Toys R Us, he picks up something. Dad, this is only so much. Can you afford it? Okay, but that's fine. It is very transparent. He understood that there was a limit to which he could do something.
Right.
And I think that also helps children. So I would say consistency, transparency, and fairness in the way we deal with them, and not expecting them to do stuff that we don't do ourselves,
Right.
helps.
And how does all this play with the brain? And what happens? How do these patterns, these are patterns, right, that we're setting in childhood, how do these sort of imprint themselves on the brain and then fashion the individual as they go along?
Very much, if you think about it, the vast majority of humans are, in a way, they are products of their environment. And our greatest influences come from home. Because we spend far more time at home with our parents and siblings than we do in school or anywhere else, usually. So, in a sense, these patterns, as you call them rightly, are extremely important because they imprint themselves. And if those are good patterns, then they are likely to stay with the child for a very, very long time. Something as simple as, for example, putting things away after you use them, or having a place for everything in your room. These are things that, once imprinted, tend to follow the person through a lifetime. So I think that there is definitely an opportunity to set good patterns. Like meal times. Having reasonably fixed meal times is something which is very good for children and very good for all of us. And adherence to that helps the child then make that into a pattern in the long term. It also prevents, very often it prevents snacking, very often it prevents unhealthy eating.
Right.
So, there's that whole exercise. Doing things together as families can be extremely good for children to, I know families, for example, where they play sport together and watch sport together. And so it's a very good bonding activity, and at the same time it's a very positive impression for the children that they stay with sport in some way and they continue to engage with sport. Through life.
Yeah. Now, growth mindset is something that a lot of startups talk about. But actually this is derived from early childhood development. Can you talk about this growth mindset through childhood?
Sure. So I think part of this, of course, if you think about it, is aspirational society you live in, and the wow factors that you yourself create. So to give you an example, if you're driving with your child and you see this fancy car in front and you say, wow, you are passing on a lesson to the child that there's something wow about that car that's not with our car. You're teaching the child to discriminate two things. And it's not just about color and beauty and being dashing. It's something else. It's an influence that you're perceiving something in that. And I guess, therefore, if you think about it, because society continues to throw at us better and better and better things, there is always going to be that aspirational mindset within, unless you're one of those people who is very minimalist, very contented, has a very few things at home, and lives a relatively isolated existence, and that's all your child knows. That's very few people in society. The vast majority are following the path that everybody else does.
That's right.
So I think there is that, and you're battling that constantly. There is also another side to this. The studies of happiness have shown that happiness comes from your two umbrellas. Your smaller umbrella is your family, happiness umbrella, and your larger happiness umbrella is your community. And one of the key components of happiness seems to be giving, altruism. That if you can learn to be altruistic, that is one of the ways in which you are guaranteed happiness. So, in a sense, if you think about it, if a child, through the activity of the parent and the family, is learning those lessons about sharing, about giving, about participating in society, then those are very, very valuable happiness lessons that child is imbibing from earlier on in life. And it's likely to have a very positive impact on the child's mental health as the child grows up. And it's going to give the child tools that will make her or him happy quite automatically in the future, because they saw that they could do this and it had this impact.
So actually, today we talk so much about influencers and influencer culture. Parents really are our strongest influencers then.
Absolutely, unless of course they've not been able to spend too much time with us for whatever reason, or indeed we ended up spending time with other people more than we spend time with our parents. But I think what is true is that the people in our environment, especially the parents, but also siblings, maybe uncles and aunts, maybe grandparents, are all great influences.
Right,
Teachers as well. Absolutely, I mean, because you spend a lot of time in school and with teachers, and of course fellow pupils. So, in a sense, yes, I think your true influences are in the community around you. This is much before social media, or much before you started being able to see somebody in a distant space doing something.
Yes. Yes. Touch is such an important part of development, right from the breast crawl onwards. Can you talk a little bit about how parents can continue the experience of touching their children through life? Because when a child is a baby, it's easy. When your child is a teen who just wants to distance themselves from you, how do you still continue that? And why is it important?
So I think there is, of course, one of the things, if you will notice, is that the need for touch and the willingness to touch varies enormously among families. There are families that are huggers, and that comes very naturally to them. And there are families who are not. They're a little more restrained in the way that they greet each other or meet each other, which also seems to come quite naturally to them. So the one element of touch is to understand that our sensory needs as human beings and our comfort with sensory activity is enormously variable. And it can vary between two people in a marriage also. And it can certainly vary across generations between parents and children. So I think there is this. The other dimension to this, of course, is that touch can be perceived as good or not good. And you often read of people who say, oh my God, that person made my skin crawl, or whatever. So, in a sense, there is that element to touch also where it's perception. It may be that the person intended nothing at all, but there's perception involved in touch, which is either comforting or non-comforting, in fact distressing. And I think that's the other unique thing about touch. The third thing, of course, is if it comes comfortably, naturally to the family, and it's been a form of greeting from very early on in life for the child, then obviously it continues probably through much of life. Except that your teenager, for example, might choose his moments or her moments when they want to give you a hug.
Right.
So the not now mom is going to be like pretty strong in certain circumstances, but it's not never. It's more to do with timing, how they are seen in their peer group, or how they see the environment around them, and so on. So to a very large extent, giving them the freedom and the opportunity to do it, but not being overpowering in our need for it or expression of it, especially when they go through those difficult years, because very small children don't mind. Once they've grown up and they're comfortable in their skin, they don't mind. But it's the teens who find a transition there, and the transition can be a little more complicated across sexes as well. So in a sense, giving them that time to adapt to all that is probably wise.
Right. As a parent, with a normal child, do I still need to come to you, and why?
So there are many reasons why children and parents reach out to a service like ours. One very important one is to decide what to do with the next phase of my life. This is something that brings a lot of normal or neurotypical children to us. And there we help them by trying to understand their cognitive abilities, their intelligences as they were, their inclinations and aptitudes, and hemispheric dominance, and use all that information to point them in a certain direction that could be helpful. So these transitions sometimes happen between, high school, between the 10th and the 11th and 12th, so that kind of time. Sometimes they happen after school, going to college, I'm not sure what I want to do. And very often now, I also find them happening when they're finishing graduation. They don't know whether they should go to work, whether they've done the right thing for themselves, or whether they should have done something else. In that stage as well, I have quite a few youngsters who reach out to us. And that's also when they start getting concerned about their cognitive abilities, their whether they have attention deficit or not, whether their mental health is okay. So there are many reasons why young people can come to us in order to understand themselves better and to figure out what they should be doing. And that's such an important thing, because if you can figure out in some logical way that this is better for me than that, then obviously then you are able to take it forward with some degree of confidence.
Right. Thank you so much, Doctor.
Thank you. Such a pleasure.
Time.